One of the key takeaways, I think, from our presentations early this afternoon was about the incredible progress we have made in covering kids. Despite serious economic problems, despite dreadful news about the uninsurance rate for adults, and as Jenny said, we have even later more dreadful news about the increase in the number of uninsured in Virginia just in the last year. We have seen gains in insurance coverage for children. And while both Jenny and Joan acknowledge that the reason for those gains is Medicaid and CHIP, our famous programs here in Virginia, I know, everybody on this dais knows that the reasons for that coverage increase is you. You are the ones who do the work every day. You're the ones who come to work every single day with the mission of helping people get the coverage that they need. And I want to thank you for that, because that really means a lot to all of our kids, and I really appreciate the work that you do. It's critically important, and thank you. So, just some other takeaway messages that I got today, including the great progress we've made for kids, but we still have work to do. The ACA brings with it many, many benefits. It brings with it more coverage, both for kids and for adults. It brings with it expansions to Medicaid, which, as again, you all know, are much more significant for us here in Virginia than they are in many other states across the country. Because our current Medicaid eligibility is so low, that leap from where we are now to covering adults at 138% of poverty is pretty dramatic. Less dramatic in many other parts of the country where they've already been covering people at a much higher level. So we really are going to make much more advance than lots of other parts of the country. There are new rules, complex new rules to learn, and serious concern for some more complex families. I'm going to date myself here. Don and I are about the same age, and I probably wouldn't pick up my name tag either because I couldn't get back up if I bent over. But I'll also date myself by reminding all of us that families no longer look like Ward and June and Wally and the Beaver. And, it's those complex families that you see every day that are going to get more complex as we go forward with the implementation of the Affordable Care Act. So you've got lots of work to do. And, Secretary Hazel and Commissioner Brown continue to ask the question, who's going to take care of these people? How are we going to get them enrolled? And how are we going to pay for it? And so they have tough questions to answer, but we're all around to try to help them to make sure that they meet the needs of the people who come to them. So let's get to your questions. It seems, folks, that there are a lot of concerns among this group related to the customer portal that seem to fall into two categories. So we'll start there.
Only two?
Well, I'm working to try to organize things here, Secretary.
Okay.
And, I'm going to start really by helping the Secretary feel at home by saying, so what did you just say a little while ago? The questions seem to fall into two categories. Concerns about the people...
No, that's not the way it actually works. You couldn't have meant what you just said.
Well, that too. But the questions kind of fall into two categories, which include concern about the people who are trying to apply and concern about the impact on local DSS and eligibility workers. So I'm going to kind of come at that in a couple of different ways. First of all, the customer portal sounds like a fabulous tool that will truly streamline the application process for a lot of people. There will, however, still be a number of applicants or potential applicants who aren't able to use that customer portal, who aren't computer savvy, who have language difficulties, etc. What are we doing to ensure that everybody who needs coverage has a way to get it?
One of the things, great. I like to address that from just a service delivery question. Where will people be able to receive services? Will they still be able to go to a local Department of Social Services? The answer is yes. But they will not only be able to go to the local Department of Social Services, they can also go to the Community Action Agency. They can also go to the library. They can also go to downstairs to their kitchen table. They can go and literally apply anywhere. But for those who are going to need specific assistance, they can definitely walk to their local Department of Social Services. There are different states that have employed these delivery systems, these portals, and some of them, I can just think of one, and it's more of an outlier. I think of Florida, where 99% of the individuals who actually apply online. But Pennsylvania, which has also had a portal, 35% of their caseload applies online, which means that the other 65 are walking through their local departments and are actually engaging with the local staff. We see this as a process that will transition people in the same way that we're educating our staff, our workforce, those who are actually going to be serving those walking through the door. We're also going to have to educate the clientele, those potential recipients and enrollees of Medicaid and of other things. And so even that is going to be a long-term process. I use the example of going to an airport, 10, 15 years ago when they just put kiosks in. And the first time I saw the kiosk, they direct you to the kiosk, and I wanted to catch the flight, so I didn't want to get in line to the kiosk. I wanted to get in line where the person was so that I could get my ticket, so I could make sure that I got on the plane. But they directed me to the kiosk, they walked me through the process, and I got on the plane. I got to my destination. Now when I go on the airport, I don't even think of getting in line. I just go to the kiosk and I swipe my card and I get my ticket and I get on the plane. It took a process of trusting the technology, trusting the process in order for me to know that, okay, this is reliable, I can trust it, I'm going to use it. And that same process is going to need to occur with the client base as well, whether they're hard to serve or even folks who are able to apply online without any difficulty.
So having said that, Commissioner Brown and Secretary Hazel, we've got benefit program supervisors who are really concerned about the mass of new applications that they're anticipating as a result of the expansion of Medicaid.
I don't worry about it because I got people to handle that.
And you know what? These are those people. So the question is, are these folks going to have additional resources to be able to help them handle that?
Why would you need more this is the resource.
Okay.
This is the resource that's going to actually reduce that workload. Now, there is an expectation of increase. We're creating greater access, so more people are going to apply. We're expecting a 10% increase in the number of applicants. At the same time, though, we're reducing the actual enrollment process and the amount of time necessary to enroll, because the application and everything, as we've discussed earlier, that is going to simplify and make the process easier and less cumbersome.
I can add on to that. In terms of what you're already doing, in terms of the social service benefits, the Medicaid applications and things, this is the tool that we hope to use in lieu of more people. When we give you more people, then you need more space. You don't have spaces, they telecommute. They're just a whole series, and we think that this is a tool that should simplify the processes and also be scalable to a large extent, and there'll be a role of self-service that will help with that. Now that being said, I know that it says, well, can't be that easy, and I'm sure it's not. But as far as the increased enrollment with the PPACA, I think that is the one that we've been focusing on the most. This is going to be one of the tools that we deal with this, and we're going to have to see how it works and what the needs are going forward. The influx doesn't technically hit us until October of 13, and we don't really expect everybody to come in the same day because I am now newly eligible. This will be something that will mean processing applications over time, and ideally by automation of more the less complex things, the reauthorizations, we free up time to do some of the other work, and that's the goal. Now, in terms of the health benefit exchange, probably what really frightens you is the fact that, well, we might have to do the benefits for the health benefit exchange. And again, hopefully a lot of these people will be able to almost self-serve in an ideal world. And you're going to say, well, that never happens. But the exchanges have to be financially self-sustainable. That's the rule. They aren't going to get federal money. So it would be our anticipation that the exchange will have to build in the transaction cost as part of the product cost, and that we will need to pay for that enrollment service.
Okay. Shifting gears a little bit to some of the data that Jenny, you presented. We looked at the map that showed Medicaid participation rates varied across the state. Are there data to help us understand some of the reasons why kids and families don't enroll in Medicaid when they're eligible? Some obvious things in terms of the level of knowledge and outreach, but beyond that, what might be some things that we can know about why kids don't enroll and those participation rates are as varied as they are?
So the first issue is that there are some families who really don't feel their kids need coverage. They have kids, thank goodness, by and large are healthy. In some families, I think there's a resistance to taking a public benefit. But all the research that's been done on this topic suggests that those two reasons actually are a very small part of the reason that we have, 4 million uninsured kids are eligible for public coverage but not enrolled. The knowledge barriers about eligibility are very real. Even after all the efforts that have been made, many parents don't understand that their kids are eligible for coverage. And survey after survey, despite the streamlining attempts that have occurred, surface a lot of issues with the enrollment and renewal processes. That families don't understand how to make it through the system, or they find that it takes a lot of time and effort and they can't take time away from work. And so those are real barriers, I think.
Okay. Go ahead, Jen.
I just want to add one thing to that, which is Jenny mentioned the renewal process, and I think, maybe Secretary Hayes or Commissioner Brown, you could comment on this, but I think like many states, Virginia has a relatively high rate of kids who have churned through the system, so they've been on Medicaid and then they, at renewal time for whatever paperwork barrier, whatever it is, I think it's a pretty high number. So they're not families that have no familiarity with the system, haven't heard about the system, but for whatever reason, barrier in the renewal process, they've fallen off. So I would just highlight that because I think that's a place to look to really try to address the problem.
I was just going to say that the national data indicate that as many as a third or more of all of the uninsured kids who are eligible were not too long ago enrolled in public coverage. So I think Joan is drawing attention to a real piece of the puzzle.
Well, she does, and RWJ, of course, works with us through Max Enroll, and I don't know, maybe even some of you were interviewed, but RWJ sponsored a consultant to come in and went around the state and talked to folks in the social service office about the eligibility process and what do you do first and what do you do last and why, and we were looking at the numbers, and the renewal issue does continue to be a problem, and I think that what has at least I've gotten in my mind is that it's the issue is really resource allocation to that, and maybe there's some procedural things we can do, the timing that we allot for the process, get renewals done more, a little more easily is an issue, but it's just that when you've got people who need SNAP benefits that they've got to apply for, and that the Medicaid is kind of going to be okay, most likely you go there first, and that's something we have to address with policies and procedures and look at what we're doing in the application process. But again, that should be the low-hanging fruit for automation.
Yeah. If I can just add a couple additional points. Yes, the automation is going to correct that, but it'll also help us to see where those renewals are not occurring and be able to pinpoint, okay, what are those very reasons why there's a low participation rate in a particular community. And so the automation will also help us and inform us in them with that as well.
Okay. So there seem to be a number of questions around clarifying the connections between these multiple systems that either we already have or we're talking about adding. So I don't know if Donna, you or Deborah might be able to address some of that. So for example, question says, how will existing cases be put into the customer portal? Will there be conversions of data? How's the portal going to interact with ADAPT? with the implementation of the portal and the large number of online applications, how will the applications be assigned to the CPU? So there's some concern around, we've got all these systems, and when we first started talking about this, Secretary Hazel talked about the acknowledgement that we have currently lots of systems that don't talk to each other. So now we're kind of overlaying this kind of the portal, which seems to be the way we're going to get in. But how then are they going to connect with the current systems, ADAPT, for example, and some of the other ones that we're already working with?
Yeah. Well, may I make a comment while you all are planning your thoughts? You all probably come to this with some skepticism that we can pull this off.
It's kind of what they were hoping for, I think.
Yeah. Now, I learned very early in my tenure that Vita is a 4-letter word. All right? And I think I need to answer a little different question about this. And the first is really from day one. We went, I won't say day one, but my 5th day as secretary, Saturday morning, 6th day, we're going around the room with the staff folks who were left. This was last January. And it was Vita this, Vita this, Vita this, and finally got to Ray Hopkins, who's commissioner for the blind and vision impaired, and he says, it would just be so nice if the help desk was helpful. Now, part of being a secretary is you get to live in a hotel for 4 months, and the Secretary of Technology stayed in that same hotel, Secretary Duffy. So we got to be pretty good friends and remain, but he's just down the hall from me. And what I will tell you is that through the Northrop Grumman contract redesign, Duffy and I would meet pretty much every night for dinner, and I would take him through the latest war stories that your DSS team had brought to me. And we would start isolating out the problems. Okay, service, we know that price is an issue, we know that's but what I would like to tell you now is that as we've gone through the re-engineering, Vita has assigned a new project oversight manager to us who works just with us. We have, I believe it's not perfect, and I know, and I've expressed, the Northrop Grumman people came in to me, I'll tell you a little, so they came in the first time to introduce the new team to me. And in about 15 minutes, they were down the hall at Duffy's store wondering what was wrong. Because, I asked them, why are you guys still in this business? And he said, well, and because I said, didn't your CEO say this is a one-off, you're never going to do this again? Why don't you just give it up and let us go find someone who wants to do it? And it was most unusual conversation, but we've been trying to talk to each other again and build a relationship. But what I will tell you is that there has been significant improvement at our level. Now, what I perceive is that you all aren't feeling the love yet. And because when I've been around and I've visited a number of social service agencies, the question comes is, well, what do we do about Vita? And what I need from you are really the evidence. I need to get you to copy the commissioner or to copy me on some of the problems you're having, and I'll walk it myself down the hall to Duffy, and I will. But this was the theme of my last meeting with Northrop Grumman. You guys got to go out and talk to the locals because you're not getting it done for them, all right? But I do believe that there is an effort being made they understand, they value this business. In fact, the guy in the first time said, well, the contract's working for us, and that's what we're doing. And I said, well, I'm glad it's not working for us. But I do think we're making some progress there. And the Northrop Grumman piece is one part of it, but the Vita piece and what we do have some control over, I think is much improved. And they are working with us on this project. Now, procurement is difficult and it's slow, and there are constant little things that come up, and information security is an issue. There are lots and lots of little pieces of this puzzle, but we are really working as a team, and we are working across secretariats. We got transportation, we've got technology, we've obviously got Vita involved, and this is a very, very big and high-profile project, and we are determined to get it to go right. I don't know whether that gives you reassurance or not, but we really think that this is going to work. And if you hear the progress we've made on the portal, we couldn't have done that 2 years ago. I mean, that was obviously before my time. We couldn't have even done this last year, but it is being done now. So please work with us on this. And if you've got specific concerns that I can address, let us know. I'm sorry, but I needed to get that.
It's all right, you got to get it out.
Yeah.
Deborah or Donna, do you have anything to add
Yeah,
about
just-
the connections?
Yes, just to add to what the secretary is saying, the technology is being built so that the information will flow, believe it or not, from a web-based system or solution, which will be the portal, into a mapper-based solution, which will be ADAPT. All of those technology issues, Secretary is working hard with Vita to get that done. Now, when you speak about the conversion and what the customer portal will bring to you in March, we just want to make it clear that in March, the customer portal that you will get is not where we're going to go with healthcare reform. It is just an incremental step that will get us there. So for what you will get in March will be the information will actually be pre-filled into the ADAPT solution. That information will go in through the technology that everybody's been speaking about. There will be additional data fields that will be input automatically from what the customer enters, and that will be pre-populated into that system. So any application data that exists out there currently, let's say for the VNAN application, which is SNAP, we will work out an implementation plan for any of that portal data that will exist for VNAN to actually be worked on and processed before we have to place it into the portal. And remember now, the portal is just a temporary holding pattern for where this data is going to reside. That's not where it's going to stay. It comes in there from the customer, but it is immediately shot out into our legacy systems and processed there. So the transporting of that data will be done in technical means, and it is going to be accomplished. Now, at the point we move into the next incremental phase of moving closer toward where we want to be with healthcare reform, when we move toward that new initiative, it will be looking at a case management solution for Medicaid. And at that particular point, that's when you start talking about conversion of data, because the data actually lives in a mapper solution, which is called ADAPT. And we will need to get that data from ADAPT to a new case management solution, and that's when conversion comes into play. So that's not going to be a problem when we release in March. Again, Secretary, yes, we will deliver. Conversion will come later.
I believe the proper words is, yes, Secretary, we will deliver on time and under budget. Those are the proper words.
That's
Let's
the
get that.
And fully functional.
And fully functional, yes, thank you.
Okay.
So what a team.
All right, we have just a few more minutes left, so a few more questions. So recognizing Jenny's data that approximately 73,000 uninsured adults have children, currently uninsured adults, have children enrolled in Medicaid. What is Virginia doing to prepare to automatically enroll those parents in Medicaid when they become eligible on January 1, 2014? I'm not sure that was a Jenny question. I think that's a Virginia question.
That's not even fair. He's setting me up. The answer is we haven't crossed that particular bridge yet.
Yeah.
Okay.
It's that simple.
Are we aware that they're there and there should be a bridge that
Yeah.
we're trying to
Yeah.
cross?
We are aware that they're there, and I'm going to defend my DMAS team right now. Their project list in August had 73 discrete items on it. Now, not all of them were as big as this one, but in terms of the priority of getting things done, that's a relatively easy thing to do, I think, once the system is there and you open it up. The key to this going into the future is the ability to do relationship mapping and in a system, and we will be able to do that if everything moves it moves according to plan. And we are working now. The big issues that we're addressing now are the security and the privacy issues. They're huge. But what we actually already have the tool that would allow us. I mean, let's change subjects. Let's go to children's services for a minute. And we have the ability, with the technology, has the ability to find the kin for kinship care. I mean, it's got the ability in the system to do it. You can watch, you can, if you wish, use it for all of these things. Now, some would call those nefarious purposes. Others would say those are the greatest things since sliced bread. And those are the problems that we're waiting. So actually establishing the relationship pattern is not really that hard to do once the information is in the system.
Okay. So, Joan or Jenny, how will the Affordable Care Act impact children in foster care?
I'm going to say we're just about to start a project for the Annie A. Kesey Foundation on this issue, the interaction of health reform and children in foster care and other high-end service systems. So stay tuned. We'll be developing some materials on that, but we haven't started yet. I'll just mention, as many of you probably know, there is a state option in the Affordable Care Act to retain Medicaid for kids aging out of foster care up to the age of 26. That's something your state could take advantage of.
What we are doing now, we have a pilot program in Richmond. Who here is from Richmond? Anybody? The pilot project in Richmond is that the kids in foster care will automatically be enrolled in sort of a managed care program. The goal is to get them into a medical home. If this proves to work out, we are tentatively planning to extend that through the state. Now, understand we have to put the money in the budget now for that, and they make the plans to do that now for that, even though we wouldn't be able to go till next July. So if the program works, we think we're set to have these kids in a care coordination system, hopefully with a medical home or a primary care physician to give some more continuity in care. At least that's where we are now, and we're going to wait and see how it's working in Richmond.
Okay. So just, two more quick questions. Well, one more quick question, then one more, and then a final question related to training. So how and when do we anticipate local workers will be trained on the portal?
We have a tentative schedule that we're looking at for the first phase rollout, which will be in the month of March, the month of February for training, and we anticipate that tentatively, and for the rollout for June for May. So we are anticipating some type of hands-on type lab situation training in those particular two phases with an ongoing e-learning experience that we hope to start sometime in early February, January, throughout the time. It will hope to be used for new workers who come on board even after we've already implemented and started for refresher training. But we want to try to utilize as much e-learning as possible with new technology.
Okay. So before I ask the final question, let me just let all of you know that, as you can tell, many of these were not short answer questions, and these are not short answer people. So as Rebecca said, all of the questions that you all provided both before the conference, some of you actually submitted questions in advance, as well as the questions that are on the cards, will be consolidated, will be presented to our experts for their responses, and those responses will be posted. And so you'll have the opportunity to go back and look at some of those questions that didn't get asked this afternoon. And again, I apologize that we didn't have time for all of them. But I thank you for your thoughtfulness in approaching these questions and really helping us to get the most from the folks who are
Judith,
here.
may I see the questions, please, real quick?
Can you see them real quick?
Yeah. Well, this is easy. The answer is no. This is Norton. And finally, yes, Fairfax County, but that's okay. Thank you. You want quick answers?
But I will give you the last word, sir. One of the questions is, are the key players, the Secretary, the Commissioner, Deborah and Donna, sticking around to see this through?
I have to.
Yeah.
I can't retire.
Yeah, she
until
does.
6 years.
She does.
6 years. I got 6 years.
There are, Commissioner,
Yeah.
do you want to answer that, or?
Well, I mean, is it want to or can? I mean, the obvious answer is would want to, but the reality is it's not our call.
Yeah.
There will be a new election in November 2013, and there'll be a new governor inaugurated in January of 2014. And so, it'll be up to that new governor to select who he'd like to leave.
We are called at will.
Yeah.
And, you know, we could be gone by Christmas if the governor wishes us to be.
Yeah.
I don't think that's likely to happen, but what I would tell you is that we're looking through the Secretariat, and I know that Donna's working with social service in particular towards performance improvement. One of the things we try to do is we set the goals for the agency, and this goal is so set, and it will be so much in the infrastructure and the EWPs and so forth that it would be awfully hard for it to not, continue. There's so much invested in this, and so whether we are here, who knows, our successors may be better at it than we are, and they'll be faced with perhaps a different set of challenges. But I really believe that the team that is doing the work, as Debbie talks about, that she knows what is, and she's got a whole team out there doing it. And this is the team that's needed at this point. And I believe that, as is the case when I came, what I know I learned from them. I'll be honest with you, and from going around. So we learn from them, and we learn what we need to do, and part of our job is just hold on so we don't get thrown off. And I think that the next will, but I do believe this project will continue due to the commitment to it, the investment of the General Assembly in it, and it will not go away.
Great. Well, thank you all, and I know you all will join me in thanking both our guest experts for coming down and joining us today, as well as our resident experts. I think that we in Virginia are indeed very lucky with the progressiveness of the Secretary in really taking so much of this and moving forward with it despite lots of challenges along the way. So thanks to all of you.